Well, cash pay is the way. I mean, that's ultimately what we're trying to say is cash pay is the way. I kind of like that. It rhymes. I think it's the first time I've said it. So thanks for the idea. Yeah, I might steal it from you.
Awesome. I'm very blessed to be here with Andy Schoonover, CEO and founder of Crowd Health. He's also the host of the Sovereign Health podcast. Andy, thank you so much for being here today.
Yeah, thanks for having me.
Can we just talk a little bit about what Crowd Health is? I've been a member for 18 months, and when I tell people what it is, I usually just say it's an alternative to insurance. It's an organization that facilitates
Mhm.
crowdfunding for health events. Could you elaborate on that?
Yeah, let me give you a little bit of a background, and I think that'll give the listener some context for why does there need to be an alternative to health insurance. Um, this is my second go around in healthcare. My first one sold my company a while back, and as such, I didn't have health insurance because most of us get health insurance through our employer. And so I thought my only other option was to go to the Affordable Care Act plans, also known as Obamacare. And so I got it. I think it was $1,200 a month, $1,300 a month, something like that for me, my wife, and
Wow.
my two girls. And I kind of joke it worked until I had to use it. My little one was having recurring ear infections. She was about one at the time. And so we went to the ear, nose, and throat doctor, who said, yeah, she's got a hole in her eardrum. She has to get tubes in her ears, which is basically just, this little, I think, plastic that they put in their eardrum so that it can drain out all the liquid that's coming from her ears, because all that liquid buildup presses up against your eardrums and creates ear infections, but also it creates a ton of pain. And so we said, okay, well, we'll go get those tubes in her ears. There's one place in town that was in network from my plan. So we went to that, got it done. It was a 15-minute procedure, so super fast. We got the bill a few weeks later and it was $8,000. We're like, whoa, $8,000 for 15 minutes. This is what health insurance is supposed to be for, right? Little did I know I was going to get another note in the mail, something like a month later, from my insurance company who said it was medically unnecessary, and so they weren't going to pay for it. And so I'm sitting here thinking, okay, my ear, nose, and throat doctor said it was medically necessary. Her ear infections have gone away, which seems to indicate that it was medically necessary, and so you're saying it's not. And so I went through several rounds of appeals, and at the end they were like, nope, we're not paying for it. So I had to stroke an $8,000 check to the local hospital, and it was at that moment where I was like, this health insurance thing just doesn't work. Little do people know that I live in Texas. About 20% of claims in Texas from Affordable Care Act plans are denied. So, 1 out of 5 are denied. And I was unfortunately the one. And it cost me $8,000. And so, in essence, what this is doing is it's putting people into bankruptcy. I've been super
Right.
fortunate. I can pay $8,000, but most people don't have $8,000 laying around that they're going to pay for, a pretty kind of benign thing. And so it was at that point where I was like, okay, I'm gonna do something different. I called my health insurance plan and I quit, and I decided we were going to be uninsured. So I've been uninsured for now 4 years, maybe even longer than that, maybe 4.5 years. And so I started building these tools that would allow people to, or allow my family specifically, to operate outside of health insurance. So it's like, what are all the things that could happen to us that would require us to have health insurance, and how would we, respond to that? And so, I didn't realize that I could negotiate bills at the hospital. I could have negotiated that bill from 8,000 probably down to a couple thousand. I didn't know that. So I, started negotiating our bills. I found that virtual care is significantly less expensive than if you show up to the doctor. And so ultimately I put all these tools together to form Crowd Health, which in essence is a portfolio or a toolkit of tools that allow people to operate viably outside of the kind of medical, what I call the medical industrial complex, which is, the group of companies, including hospitals, health insurance plans, pharmaceutical companies that make more money when you're sick than when you're healthy. And so how do you viably operate outside of that? So that's a little bit of the backstory and what we're doing. I'm happy to kind of get into the details of how it all works. But yeah, I think your description of Crowd Health is a good one, which is, we're just trying to provide people an alternative way to pay for healthcare bills outside of the legacy health insurance space.
Yeah, thank you for sharing that story. And first of all, I want to say I'm very grateful that you decided to take action and build these tools and build out this company, because I've been a member for 18 months and I pay between, $100 to $150 a month, like a month, which is just incredible when you compare it to insurance. So I've saved like many thousands of dollars in the past year and a half. So yeah, I'm
That's
very
awesome.
grateful for that. And I also really like just the energy and the ethos that Crowd Health has around, like, we're all supporting each other and the care advocates are there for you. You can talk to them.
Mm-hmm. Mm-hmm.
So it's great. And I just want to talk a little bit more about this like insurance system that is flawed. And like it appears to me that they have, like, the big insurance companies have an incentive to collect as much money as they can and pay out as little as they can.
Right.
So if the profit margins were to stay the same, the way that they increase earnings is by raising healthcare costs, prices, and keeping people sicker and sicker. And that's how their earnings go up. And that's what the incentives, point them to do.
Yeah.
Whereas the difference is, like, with Crowd Health is I'm paying a $50 a month membership fee to Crowd Health. We're paying for them to facilitate great healthcare, negotiate, find good doctors,
Mm-hmm.
and then I also do a contribution that varies. I think it's $100 to $130 a month, um, and that goes directly to somebody's health event, funding their bills. So
Mm-hmm.
then, when I have a health event over $500, I will then receive funding for that as well.
Mm-hmm.
So the incentive structures are different here. Can you like talk a little bit about that? How did you
Sure.
design that?
Yeah, I think there's so many perverse incentives in healthcare. I think you hit on a big one, which is, in the short term, health insurance plans actually have an incentive for them to decline your claim, right? So they're fighting against you to get your bill paid. So for any 1 year, I collect $100. And let's just say $85 is used on medical bills, I get the $15. And so there's an incentive then to have those bills be, decline those bills. But the really screwy thing about this is that they actually have an incentive to see healthcare costs increase over the long term. So there was a
Right.
part of the Affordable Care Act that basically said that health insurance plans can only make a 15% profit on the premiums. So if your premium is $1,000, that the most they can make for their profit and administrative costs is $150. So then, how do they grow that profit to, let's just say, from 150 to 165? Well, your premium has to go from 1,000 to 1,100. So they actually have an incentive to see you be sick over the long term. They have an incentive to pay the hospitals more over the long term. And so in the short term, in any 1 year, they tried to reduce the claims so they can make as much money as possible. Over the long term, they want the healthcare cost to trend upwards so they can make more money. And so it's just a totally perverse incentive system. And so when we thought about Crowd Health, when we started, we were just like, look, I want to be 100% aligned with our members. We originally were like, well, why don't we just take like a percentage of what our members ask from the community? Let's take 10% or something. And then we were like, no. Then our incentive was for the bills to go up. We don't want the incentive for the bills to go up. We want the incentive for the bills to go down.
Right.
And so we said, okay, well, why don't we just do like a subscription fee? Like everybody's comfortable with subscription fees nowadays. Let's just make it $50. And if no bills come in for us to crowdfund, I make $50. If a ton of bills come in to crowdfund, and make $50. And we have the incentive now to help you reduce your bills as much as possible. So the crowdfunding costs for the entire community go down. And if the crowdfunding costs for the community go down, then I can go out and I can, recruit more people to join the community, which means I make more money, right? I want me to make more money when you're healthy and not sick. Like that's ultimately what we need to do. And I think we've, set up the system to do that, pretty well. So that's the way that we thought about it when we structured the revenue stream up front.
Yeah, that's great. And yeah,
One
compared to like,
real quick thing is,
sure.
people ask, and it's along with your previous question. People ask, like, with healthcare, why is healthcare so expensive? I just told you why the buyer of healthcare, health insurance companies, actually want the price to go up. The sellers of healthcare, which is these big hospital systems, they clearly want the price to go up. They want to make more
For
money.
sure.
So you have the buyer and the seller of healthcare wanting the price to go up. And so guess what? The price goes up, right? I mean, that doesn't take, an economist to figure that out. So that's why the incentives are just so perverse within healthcare. We wanted to change that.
Yeah, and that's exactly what we see now is exorbitant prices, like ridiculous prices. I've seen easily $350 for just a 15-minute conversation.
Yeah.
And I want to talk a little bit about what you recently experienced with you had a migraine episode that was severe, and it ended up being a $30,000 migraine, and they tried to charge you something like $4,000 for like a routine
Mm-hmm.
procedure. Can you talk to us a little bit about that?
Yeah. So back at the end of last year, I was on a call not too dissimilar to this, and I lost the ability to speak, which was one of the craziest things that has ever happened to me. I could not put together a sentence, and so of course, I thought I was having a stroke. So I went to the ER, and they did a CT scan and an MRI, and said, nope, not a stroke. Looks like you had a migraine. I was like, oh, thank God. And then, got out the next day and, started getting the bills in the mail. And I'm now living what our members live, and
Right.
so I'm like, I got to see it. I got to feel it. And as these bills are coming in, I was just blown away, by what these folks were charging me. And I'll get to your example, in a minute here. But, one of the more egregious ones is that an occupational therapist and a physical therapist came in at the very end of my stay, and they had me put on a pair of socks. They had me brush my teeth, and then they had me walk down the hall 20 feet. I mean, they were with me no longer than 10 or 15 minutes. Well, for that visit, they charged me 6 15-minute visits at $400 a piece. So they charged me $2,400 for a 10-minute, interaction with their physical therapist and their occupational therapist. And so, clearly I'm going to fight this bill, and I'm in the process of fighting it. That's probably a good conversation for another podcast. But as I mentioned, they did a CT scan and MRI, and I got this back, and what I got was a bill for almost $4,000. And I also got a bill so I got a $4,000 bill from the hospital, and I got a $4,000 bill from a radiology practice in town. And I was like, hold on a second. Like, why am I getting two $4,000 bills for the same procedure? And so I called them, and they said, well, one is for the use of the machine, and one is for the evaluation, interpretation of the scan. I'm like, so it's $8,000 for the scan. And so I was like, all right, I'm going to call the local radiology groups, bricks and mortar location, and ask how much I can get this scan for if I just came in and paid in cash. And so they said it was $1,500. And I said, interesting. So the bill's gone now from 8,000 to 1,500. And I said, okay, so is that for the machine and the interpretation? And they're like, yes, that's for both the machine and the interpretation. And I'm like, interesting. So I called the billing department of that radiology group, and I said, listen, you're charging me almost $4,000 for just the interpretation. But when I called you all you said it was going to be $1,500 for the interpretation and the machine if I were to walk in. Like, help me understand how that works. And they said, well, yada, 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 a bunch of stuff that didn't make sense. I said, fine, I'm taking you to small claims court because this is egregious. And the lady said, hold on a second. And so she, put me on hold. A couple minutes go by. She comes back and she's like, your bill, sir, was $4,000. I think it was like $3,883. If you pay right now, I'll give it to you for we'll take $400 for that same thing. And I was like, done. And so I got my bill down from $3,883 to $400 in a, and that entire thing took me like 12 minutes. I timed it just to see. So I saved, what is that? Almost 90% of my bill in a 12-minute, series of phone calls. So it just shows you that, it would be ridiculous for me and you to go to one car dealership and see a car for $20,000, go to another car dealership and see the same car for $28,000, and it just wouldn't make any sense, right? Like, and so because me and you are consumers, we can evaluate, the $28,000 car versus the $20,000 car, realize that they're different, and so the additional cost for me to go and get the $20,000 car is significantly less than $8,000, and so I'm going to go and do that. In healthcare, there is no price efficiency because there's no consumerism. And so what we're doing is bringing consumerism into healthcare and saying, no, you can't charge me a price here and then 2 miles away, charge me, 10x what you charged me. But that's what these healthcare providers are doing. And so, we're putting an end to that. I tell that story and people might be like, wow, that's a lot of work. I mean, one of the great things about Crowd Health is we'll do that for you. We're going to help you with that. We look through these bills, we see which ones are egregious and which ones aren't. If they're egregious, then we'll help you negotiate these things. We have attorneys on our side who will, reach out to the hospitals and say, hey, this is price gouging. And so you don't have to do a lot of this. We will ask you to call and say, hey, what is your cash price? But other than that, which is easy, other than that, we're not asking you to get into the nitty gritty of negotiating.
Yeah. Thank you for sharing that story. And frankly, I just think it's absurd. Like no other industry, is like this. So like a restaurant wouldn't just bring you like a $2,000 bill just to see if you pay it. I mean,
Right,
that's insane.
exactly.
So it's totally inappropriate for like business people in healthcare to be doing this. And it is price gouging. I think you said in your podcast, you said to them, hey, if you're going to price gouge me, I'm going to take you to small claims court. And then immediately they reduce the price 90%. I mean, in my eyes, they're still price gouging. Like they still committed the crime of trying to charge you 10x. So I think, frankly, someone should take them to small claims court anyways.
We want to change the industry, and I think the only way to do it is through the judicial system. We can do it through consumerism, which I think is going to be super helpful. But in essence, what we're going to have to do is go through the judicial system and even the legislative side of things to keep these hospitals from some price gouging. So, we are on, the war path here to help, people like me and you. You're a member. I'm a member. We have, thousands of other members, and there's millions of people out there that are maybe tens or hundreds of millions of people out there that are getting, price gouged by these entities, and somebody's got to stand up and say that enough is enough. Like this is just not acceptable. And my attorney tells me that I'm a bit of a unicorn because if you have a $4,000 bill, it does not make sense to spend $100,000 of attorney's fees, fighting these hospitals. I, on the other hand, am not fighting for a $4,000 bill. I'm fighting for millions and hundreds of millions of dollars worth of bills so that we can set a precedent here to say, this is not acceptable. This is illegal. And, in the cases where it's not illegal, I'm going to go after the legislative side of things and say, hey, this should be illegal. So, I'm really trying to fight for people who want to change this space and are tired of being enslaved to health insurance.
Yeah, that's awesome. I love to hear it. I think like it's not an exaggeration to say that it is a tool for slavery, because what we just talked about is people are having to file for bankruptcy
Yeah.
because yeah, they're going into healthcare debt, and there's interest on that debt and they can't get out of it.
Yeah.
So it really is a tool for indentured servitude, and it's unacceptable. Like there's absolutely no reason for this. So
I think
the
that
other
the
thing I
stat
was
was like 200,000 families last year went bankrupt due to healthcare costs, even though they had health insurance. So
right,
you have health
unbelievable.
insurance, which is supposed to help you, in the times of emergencies, so that you don't go into financial distress. But these either denying of claims or really high deductible health plans are putting people into bankruptcy. So we're trying to get rid of that. The other crazy stat, I can't exactly remember what the number was, but I think it's like 70 million Americans have medical debt on their credit cards.
Wow.
And so, again, it's just a ridiculous, system. And I think the perpetrators are the companies that I've outlined.
Yeah, I was in Peru and I had an MRI. It was $225 for the MRI with the interpretation of the MRI. Actually, I went to a neurologist to get a second interpretation and like his advice on how to move forward. That was $25. So all in, yeah, it was $250 for everything, cash pay, and it was great. So yeah, it's just hard to comprehend how they're trying to charge,
Yeah.
$4,000 for that.
Well,
Um,
cash pay is the
s-
way. I mean, that's ultimately what we're trying to say is cash pay is the way. I kind of like that. It rhymes. I think it's the first time I've said it. So thanks for the idea. Yeah, I might steal it from you. In essence, what's happening is if we can go and pay in cash, our members are getting 50% better pricing than what health plans are getting. And so you as an individual can get a better price for a MRI or CAT scan or whatever than United Healthcare can. Because what happens is I'm going in, I'm paying with a credit card, which is 1.5% or 2% or something like that, a transaction fee for the provider, versus upwards of like 30 or 40% of your revenue goes to bureaucracy, and the billing process. And so, what would you prefer? You'd prefer not having to pay that bureaucracy of fighting for the bill. And apparently doctors spend about a day a week fighting with health insurance companies over bills. So that's what, 20% of your time gone from just fighting with health insurance plans. Like, what if I can give that back to you? And so this is just a much, much more efficient way of doing things. And so cash pay is for sure the way.
yeah, yeah, in Peru, like you literally hand the doctors the cash, which
I love it.
yeah. So it makes me wonder, like, is there like a big arbitrage opportunity like for healthcare, like virtual healthcare with doctors in other countries or with radiology interpretations? Are you guys looking into anything there?
Probably, there probably is. It's, the big costs are the ones that move the needle, and
Right.
so we had like a 2-week hospital stay, that we just crowdfunded a couple weeks ago. Maybe it was last week. And the bill was $150,000, I think. And so, the hospital basically said, look, if you can pay in the next 48 hours, we'll give it to you for 30,000. So it went from 150 to 30 for 2 weeks in the hospital. And so
And $10,000 a night is what they wanted.
they wanted $10,000 a night. In essence, it came out to a couple $1,000s a night, which is still a lot, but it's one of those where it's like, hey, like that makes a lot more sense to me than, $10,000 a night. And so I think if you kind of look at Medicare, it's pretty close to what Medicare pays. So for all the services that he got. So, it's one of those things where it's like, man, there is a huge, arbitrage here in terms of like cash pay versus insurance, and in fact, what people with insurance are doing now is saying, I've got this, my family, I looked at the Affordable Care Act plan this year, to see what my family would be. And I think it was like $1,400 a month for my family, and I think it was a $14,000 deductible. And so in essence, what happens is I've got to pay over $30,000, like something like $30,000 before the health insurance plan will pay $1, which is crazy. And so, what people are doing now is they're going and getting something like fairly expensive, like an MRI, and their health insurance plan MRI is like $5,000. And, so they would have to pay that, right? That $5,000 because it's under their deductible. Like, they're responsible for 100% of it. And so they're saying, hey, well, how much is the cash price? And the cash price is like $1,500. So they're like, screw this. Like, I'm not going to run it through insurance. I'm going to pay cash for this. And yes, it doesn't go against your deductible, but it's way better than paying the $5,000 because your health plan has such a crappy price with that provider. So people are already arbitraging the cash pay price versus the insurance price. And it's just ridiculous to me that there's actually an arbitrage. Like, it just doesn't make any sense.
Yeah, it is ridiculous. And frankly, like I was saying to my point about like I happened to be already in Peru when I needed an MRI, but it would have been cheaper probably for me to actually fly to Peru for $500, get the MRI and the interpretation for 225 and fly back.
Yeah.
So,
Yeah, that's
and
totally true. That's totally true.
it's the same thing with dental over there. It was $27 for me to get a chipped tooth fixed, whereas in America it would be $500. So
Yeah.
like, free
Well,
trip to Peru.
yeah, here's a crazy story is almost when we started, we had a guy who needed a heart procedure, and he lived in Wisconsin, and so he went to his local hospital, and his whole local hospital's like, it's going to be $87,000. So he calls us and he's like, hey, I need this procedure. It's $87,000. We say, okay, let's take a look and see what else we could find. Well, he's like 90 miles from Chicago. So we looked in Chicago, and the same procedure by an arguably better doctor was $44,000. And I say, okay, we almost cut it in half by going 90 miles. And then we found a doctor who does more of these procedures than almost anybody in the country. And he would do it for $22,000, but he was in Oklahoma City. And so we called the member and we said, listen, if we get you 2 first-class tickets to Oklahoma City, and we, basically have a concierge there for the entire weekend, and we'll put you up in a really, really nice hotel, would you do it? They're like, sure. So they flew from Wisconsin to Oklahoma City, put them up at the nicest hotel in Oklahoma City, gave them 2 first-class tickets. We sent a Crowd Health, employee there to tour them around for 2 or 3 days. And the community still saved like 50 some odd $1,000 as a result of that. Right. And so it's not just going to Peru. It's like staying within our country that you could get something, significantly less. I'm sure if that person flew to Peru, they'd be able to get something even better for that procedure. But not a lot of people like to fly to Peru to get a heart procedure.
I have to say, it is stressful. I mean, anytime you're going through a health situation, it's scary, it's stressful, it's hard to think clearly. And yeah, frankly, like being in Peru, I don't speak fluent Spanish. They don't speak great English, so we have to use Google Translate. It's difficult to communicate. It's very difficult. But this is one of the great things I love about Crowd Health is like they're advocating on your behalf when you're compromised. You're literally in a compromised health position, and it's difficult to think clearly. You're getting anxiety. So yeah, people are like, when you're having heart problems, it's difficult to have the energy and the fortitude to be calling hospitals around the country, setting up travel plans. So it's amazing to hear that, that's something Crowd Health is offering. And just to the point of these scammers, like big insurance, big pharma, big medical, they're scamming people when they're at their most vulnerable position. They're price gouging them. They're trying to trick them into paying exorbitant medical bills. So it's like they're taking advantage of our most vulnerable population. So I'm glad to hear
I think the crazy thing is like they're actually fighting against you. Like, how many times have you heard people say like, oh, I had something happen and now I have to fight with my health insurance company to get it paid, right? I mean, we're for Crowd Health, we're fighting for you, like, not against you. We're fighting with you. against these, hospitals and things to help you get these things paid. So it is a totally different dynamic. And I think you pointed out something that I think is really good, which I kind of failed to mention, but it's, you are at a critical point when something goes on in your healthcare, and you want a company that fights for you, and you don't want to have to call into a call center that may or may not be in this country, and you have to tell them what's going on, and they say they're going to get it figured out, and they don't have to get it figured out, so you have to call them back, and it's like 10 times where you have to like re-engage with this company to get them to help you. And so I hated that, and so Crowd Health was set up a little bit different, where you've got a care advocate internally who will be the one to answer your questions. And so it's unless you have something major, which we have another team to help you with major stuff, but like if you have one care advocate who's like continuing to follow up with you to make sure that things are going well. And so they get to know you, they get to know your family, they get to know what's going on with your healthcare, and so if you've been around for a year and a half, yours is probably Jasmine or Kelly. You get to talk to Jasmine or Kelly or whoever it is, over and over and over again, which is super cool. And I think that's one of the things that the Crowd Health members really appreciate.
Yeah, it is. It's definitely something I appreciate. Just to be able to text them, email them, set up a phone call. Yeah, it's very convenient. Like it feels to me like a modern system where you guys are just doing what's best for the consumer using the technology tools readily available.
Totally.
And like the other thing, like to this point, is it feels like it's very helpful in that reading the member guide was surprisingly like simple to understand, very readable, like simple English. It's not like written by attorneys that are trying to make it confusing. And actually, I was asking you about that, and you sent me the member guide. And I was expecting it to be like this long, difficult thing to understand, but no, it's really simple to understand. And there's a lot of great, like, helpful information in there. So actually, I'm really glad I read it.
Good. Love it.
Yeah, and I like how like you guys include specifically like what's not eligible for crowdfunding, excluded procedures and treatments. And one of the things in there is personally assumed risks. Like if a member is engaging in these activities, then it might not be eligible for crowdfunding. So you guys rate hazardous activities include hazardous sporting activities like motorcycle racing, off-road vehicle competitions, hang gliding, parasailing, skydiving, drag racing, lighting self on fire, sporting stunts, swimming during a lightning storm, swimming with sharks, trying to break a world record by holding breath underwater, training aggressive predators, lions and tigers, prostitutions, walking home on a dark freeway. So I actually love this. I love that you specifically say this. It is a little bit humorous, but I'm sure it's true because I like to know that I'm not paying for these things. Like if other members engage in this behavior, that's not something that I have to pay for. And also lets me know, like, I mean, obviously I know not to do these things, but it really drives that point home.
Yeah, no, I mean, I think we try to be silly there, but the point was like, yeah, I mean, if you're going to do stupid stuff, or stuff that's like really, really risky, then you have to, there's nobody else should, be asked to pay for your silly, behavior. And so this is not like an out, like oh, we're going to find a loophole to not get your, get your bill, crowdfunded. This is more like, hey, nobody should be asked to have to pay for your stupid crap, And so, we try to make it a little bit humorous. And so it's, we have, I don't think we have ever refused to submit something to crowdfunding for a stupid event, yet. Maybe it'll come, but not yet. And we've now, I think we're on bill 13,000 or something like that. So,
wow.
We have not used that yet. I don't think, not to my knowledge.
One of the big questions
Nobody
I
has
had
swam with sharks, thankfully.
Oh man, I was actually inadvertently swimming during a lightning storm, so I thought back to that situation. But another thing that it lists here for under excluded procedures and treatments is alternative therapies. acupuncture, chiropractic, experimental and or unproven treatments or diagnostics. Um, so what I'm curious about is what kind of constitutes like what is considered like an alternative therapy, or like an unproven treatment or diagnostics. Do you guys have like criteria around that?
Yeah, this is another one that I don't think we've actually refused, because I'm actually a huge. I go to kind of a holistic doctor, and we have people going to naturopathic and integrative and things doctors, and in fact, I think chiropractic is on there. But if it's associated with a health event, then we will crowdfund that. So like if you have a back injury and you need chiropractic as a part of your back injury, then that is something that we will crowdfund. It is, that one was focused, and I think in our next revision of the member guide, we'll be a little bit more specific in that because, we want people to do whatever they think is right. And so we have, in essence, what we are saying is anything that a medical doctor, a DO, a DC, or a doctor of naturopathic medicine, so a DNP, no, DNM, I think it's called. Pretty much all of those things are fundable. And so, if an outside third party tells us like this is wackadoodle stuff, like that these people are trying to do for a ridiculous amount of money, then we won't submit it to the crowdfunding. So, actually, I take this back. There was one situation in which this guy wanted $100,000 surgery, and we gave it to a bunch of doctors, and all the doctors that looked at this said, "This is not going to work." It's like this is unproven, untested. There's one doctor in the country that would do it, and it was a 5-hour per surgery, and he wanted $100,000 for it. And we basically told the member, like, dude, this is totally unproven, right? And so we don't think that the community should have to pay or not, be asked to pay for $100,000 unproven, surgery. That most doctors out there said it was not going to work. Like that just doesn't seem like a good stewardship. And so that is the only time I remember where we're like, yeah, that's not reasonable. But anything else, I don't think we've said no to crowdfunding any of these other things.
Great. Yeah. Thanks for sharing that. Thanks for the clarification on it. I like that you're including naturopathic doctors, whereas like an insurance company is not going to do that, I don't think.
Mm-hmm.
And listening to your podcast, it's clear to me that you are holistic minded. Like you're interviewing people who are experts in ketosis, experts in fasting, um, like nutrition.
Yeah.
I think these things are great, and I think that that's really what healthcare should be focused on is preventative medicine. What can we do to not even have these health problems in the first
Right.
place?
Right. Yeah, totally. I mean, our healthcare system currently is built to address the symptoms, and oftentimes these symptoms are addressed with pharmaceuticals. And so what we're trying to say is like, no, let's get down to the core issue. Because in the short term, that might be a little bit more expensive than just giving somebody a generic pharmaceutical to reduce their blood pressure or whatever. But let's find the core issue here, because that's going to result in long-term cost savings. And so if we are just trying to reduce short-term cost savings, then we're not doing anything good for humanity. In essence,
Yeah,
what we want to do is help reduce long-term, symptoms and illnesses. And along with that, we are very much into like metabolic health. And so we're trying to teach our members, like, what is metabolic health? 88% of us are metabolically unhealthy, and so we try to, teach them that you need to look at not just waistline, although waistline is important, but you need to look at visceral fat, which is the fat that sits in between all of your organs. And you can find visceral fat by going and get a DEXA scan. A DEXA scan is $125 or something like that, right? Like that's the most important thing to look at. You need
that's
to look
great.
at your A1C levels. You need to look, so all of these things, blood pressure, all of these things that people need to understand where, there's basically 5 things that you can look at and have a really good understanding of the probability of you having a chronic illness, in your older age. So let's focus on those five.
Yeah, I think there's a huge role for crowd health to play in educating members on what they can do to be healthy in the long term and helping them get the resources they need to do that. Like ultimately, your incentive is to cultivate like a large group of very healthy people, so that the health events there's very low expenses in the long term. So yeah, I hope that's the direction that crowd health continues to go in terms of and I love that you already have that piece of it where you get that free annual, or it's not free because you pay $50 a month, but included in your membership is that annual health checkup with like a provider of your choice. So I think that's very, helpful for
Yeah,
people to routinely
I think it's
check in
important.
with their yeah, and then but in addition to that, I think that perhaps there's more things Crowd Health could do like on the virtual side in terms of yeah, like you just said you're doing the podcast, you're letting people know about, 88% of people are metabolically unhealthy. I think there's perhaps even more to be done in terms of like nutrition and like maybe even like connecting people. At least I have this product idea of like connecting people with local farmers markets,
Yeah,
local sources of like really high quality nutrition at a fair price. In it, in addition to what Crowd Health is already doing, which is connecting them with high quality providers of healthcare.
I
So,
love that.
do you have any
Like
thoughts
not
on
only
that
just find a
around?
doc, but let's you can press go into the Crowd Health app and you can go find a doc, right? And you can say here's the doc that I want, here's the location I'm in, here's the specialty I need. Crowd Health, go find me a doc, or we have a database of docs that we pull from. And right next to that it's like find food, right? Like press that, and it's like where are you? Here are your local farmers and ranchers that you can go out and get your food from, and these things are
Yeah,
going to be significantly more healthy than if you go into the grocery store and get your food from that grocery store. Like that nutrition component is so missing within our healthcare system. It's like we have got to include some nutritional information in healthcare, and unfortunately or fortunately, depending upon how you look at it, doctors are not trained on nutrition.
yeah,
There's
yeah. No,
something
it's
like
it's unbelievable. I
four
was
to six
talking to
hours in med school
the
is on nutrition.
yeah, I can't believe it. I actually had an MD tell this to me. The last kind of like medical doctor I was talking to when I was kind of in the insurance system, he straight up told me like we spent 1 day on nutrition and 11 months on pharmacology. I just can't believe it. It's just shocking.
Yeah,
Like
it's
one
crazy.
day on nutrition, like, and it, God forbid it was like the food pyramid with like grains at the bottom, like
Well,
so.
that's why I said. That's why I kind of said like fortunately or unfortunately, because I say fortunately because they probably would have gotten trained on garbage nutritional data like the food pyramid, which has created total chaos within our system. And so anyway, I mean I think that's it. You've got to go seek nutritional advice, most likely from someone other than your doctor, like because your doctor does not know. And if your doctor thinks they know, they're getting their information from one of these big, you know, nonprofit, medical associations.
I
The
want to
American
talk
Heart
about that.
Association or the American Diabetes Association. And by the way, guess who they're getting paid by? They're getting paid by pharma. They're getting paid by big food. And so, they have very little incentive to share with you truth, or their truth is they're so blinded by the truth because of money. um
Exactly.
they are
They're lying to
deceived.
themselves.
Yeah, they are deceived by the power of money. um and so yeah, it's one of those things where it's, man, I love that idea. Now I've got two great ideas from this podcast from you, so I might put these into place. Right, watch out in the next Crowd Health app, the next version, we're gonna have a find food tab on there so people can go find local food.
Yeah, I have a few other things that you brought to mind for me. The second thing, like while it's alive,
Am I paying you for this podcast? I feel like you're my consultant right now.
So I think another big part of health is that community piece that I think is
Mhm.
overlooked traditionally. I think it's very unhealthy for humans to live alone, to eat all their meals alone. I don't think it's good, at least in my experience. And actually, the Surgeon General of the US federal government came out with a report that said we're having a big problem with loneliness in this country, and it's actually
Mhm.
costing people their health in various ways. And so, like, I graduated college, I moved around for work and stuff, and it's difficult to make friends. Like, as an adult, you're used to making friends in school or at work, especially if you're working from home, if you're a freelancer and you're moving around, it can be very difficult to like find a community. So, and that can have an effect on your health big time. So,
Mhm.
recently I have been able to settle down and find a community. But yeah, really much not an easy thing to do to find an in-person
Right.
community. So, I wonder if there's an aspect there of like connecting members with in-person events, in-person communities, whether it's Bible studies or sports leagues or meetups, whatever it is. I think it can have a pretty healthy impact for people.
Yeah, man, you speak my language. I mean, I think that our communities have deteriorated over the last couple of decades for sure. As we've gone, deep dive into, virtual, we have become less desirous of in person. Um, and so it's like, how do you build community? And you've probably been the 20th person to say, oh, you should have crowd health meetups. And I think that would work in communities where we have some scale, where we have hundreds or thousands of members. Like I think that will work really, really well. In the meantime, I'm trying to build a community online. Like, how do we build a community of people who can share with each other ideas and things like that, like we're doing now, right? Like, we have a Telegram group where we, have a bunch of people who get together and share ideas and share war stories about their healthcare bills and all these kinds of things. And so we think that community is really important. So much so that what we're starting to do now is we're building kind of sub crowds within crowd health. So we've got I'm calling it the OG crowd, like the original crowd. We have spun off or in the process of spinning off a Bitcoin crowd. So it's just
Ooh,
Bitcoiners. They're going to fund each other in Bitcoin. They're
wow.
funding each other only. So if you're not into Bitcoin, don't get scared. This is not going to impact you if you're a crowd health member. We're also looking at building a crowd. We're working with a couple carnivore kind of big names in the carnivore keto space. We're going to start a ketovore, what I'm calling a ketovore group, which is
Oh yeah.
the low carb kind of group where it's just got folks who are eating low carb are able to fund each other's healthcare expenses because both of these kind of affinity groups do believe what they're doing ultimately leads to lower costs. From the Bitcoin group, they're paying in Bitcoin. Bitcoin's going up, so therefore their healthcare dollars denominated in dollars are going down. Right. With the ketovore group, I'm a keto guy. I've done carnivore on occasion, but primarily keto. They think they're taking care of themselves. They're eating nutritiously, and therefore their bodies are going to be more longer lasting with less illnesses, less diseases, and therefore have a lower healthcare cost. And so that group is probably going to have a lower monthly, ask than a group that is not keto or carnivore. Um,
Mhm.
so, we're starting to build communities of people where they feel like they're a part of something.
Yeah,
They're funding people from their own tribe who are engaging in activities that are similar to them. And I see this. My goal over the next 5 years to have 10 of these crowds with 10 or 15,000 people in each one of them. And so I think with that scale, we can start having meetups and things like that where we can get enough people. Funny enough,
great.
last year at a conference that I was at, we had a little uh, crowd health happy hour, and we had 125 people show up. So at one conference,
Excellent.
it was super fun. We had a great time. Everybody got to know each other, and I got to meet a bunch of our members, and so that was a lot of fun.
Yeah, I would totally join the keto board group. I myself, I try to be as, keto as possible, but to have like to be in a group like with other people doing the same thing, I think there's a sense of solidarity there as well that can even help me like find my way in my keto journey. Because yeah, like I grew up 25 years eating sugar and grains.
Hmm.
So over the past couple of years, I've been
Same.
starting to transition to a more healthier way, and
Yeah.
I feel pretty good. So.
Yeah. Well, if anybody, we'll put a little promo code for y'all. Chris J. We'll just call it Chris J if that works for you.
Heck
And
yeah.
anybody who wants to be a member of that crowd when we get it set up, use that promo code Chris J. Anybody who uses Chris J, we'll put in that crowd when we get it started. It should start here over the next few months.
Nice. So I want to talk to you about a recent experience I had. I said I was traveling in Peru. I came back. Yeah, I had a stomach infection in Peru that I took some antibiotics for. I felt better. Came back.
Hmm.
I had kind of like more intestinal problems in February, and then yeah, one night I had like extreme kind of abdominal pain. So I went to the urgent care and they said you got to go to the ER. The urgent care they just said go to the ER. So I paid $160 to be told to go to the ER, which is great. So I go to the ER and it's packed. It's like 6 hour wait, like minimum, which is terrible. And so I stayed there for about an hour and 20 minutes before I talked to the triage nurse who said, you need to do this blood test and then, stay for 6 or 7 hours to wait. And I'm like, well, I can't stay here all night. Like, this is
Yeah.
not reasonable. It's actually gonna make me feel worse because I'm getting anxiety, getting more inflammation. I'm like getting, so I just decided to go
Hanging out in
home.
the ER room with a bunch of sick people, hanging out. It's brutal.
Exactly. It's like a nightmare scenario. Like it looks like the apocalypse. It looks like people in the waiting room are about to die, and that's just not where you want to be. So I decided to go home. And I ended up reaching out to Emma Ford, who I heard on the Health Upgrade podcast. I reached out to her and I was able to get a virtual appointment with her. She's a certified nutritionist and gut health specialist. And she was able to help me a lot in terms of just immediately telling me a lot of things I can do
Mm.
to like make my symptoms go down, and then long term we're gonna like do a stool sample test at a lab, figuring out which bacteria I have causing this infection, and take steps from there. So I wanted to like talk to you about like is that like is she's in Vancouver, so I did like a video call with her. Is that something that like Crowd Health like do you guys would that be eligible for crowdfunding?
I would think so. I mean, I
Yeah,
think that you could make a case for sure that like that helped you, and in essence, it kept you from, having a much larger, you know, ER visit, right? Like I'm sure that ER visit, they saw you real quick, and then they got. It sounds like you got out of there, right? And if they would have took you actually into and admitted you, right, stayed overnight, that would have been $20,000, probably, right? And so what you did was significantly less than that. And so I think you have a really good case to say like, look, I took the lower cost option here, right? Which is what we
right.
want people to do. We want to incentivize people to do. And so from my perspective, that is something that we would crowdfund.
Awesome. Yeah, I think that like herbs, supplements, nutrition advice is very valuable and overlooked in like the modern medical industrial complex.
Totally.
Um
I think the
and
other
the
thing
other
too I'm thinking about here though is one of the things is if you think about like how you take care of your car, right? Like in an auto insurance, like it is for like big stuff, right? If you get into an accident, um, it is not into oil changes and windshield
right,
wipers and tires and things like that, right? Like that are going to cost you money. Um, but windshield wipers and tires and oil changes and things like that are very inexpensive because, or not that expensive. I think you can get an oil change nowadays for like $25, right? Because of that consumerism, right? Because the person who owns the car has to pay for it, you know? And so what we're trying to do is saying, listen, like crowd health is great for the big things, and then the other, and if we just do the big things, then all the other things you can pay for on your own, those keep those things down, those costs down. Like they don't get lost in this, bureaucracy of getting it paid by somebody else. Right. And so that's why supplements are not included in crowd health. That's one thing that is not included, because we're like, look, supplements are so inexpensive in the general
Right.
scheme of things. If a third party, and we're not really paying for it, your other members of crowd health are helping you pay for it, but like you no longer have an incentive for those supplements to be inexpensive, right? Like you are
Right.
giving it to somebody else so that they can help you pay for it, and most of the times they do with crowd health. And so what we're trying to do is like, look, if people own the cost of some of these things, then the cost will stay low, and so it's just
Right.
this balance between, like, we think of health insurance and then we want them to pay for everything, but the more things they pay for, the higher the price is, right? What we're saying is like, hey, don't do health insurance, do something different, which is you pay for most of the stuff and you can get it for really inexpensive. But for the big expensive stuff, like that's where you need a community of people to help you out. And so we're trying to have that balance, which is just total counter to how we've been groomed to think that, healthcare should work, right? We're groomed to think that healthcare should pay for everything. Where I'm saying is like,
Right.
no. Healthcare should pay for the big stuff, right?
Yeah.
And therefore we can, crowdfund $150 or whatever, a month, 130 or whatever it is this month, 125 this month. We can keep it at 125 as opposed to 600 if you were to get it from some other place, because you now have 500 or whatever dollars, 475 to go and spend on whatever you want, right? And if that's
Right.
supplements or other stuff, like great, like you have all that money to go and do that now, and it keeps the cost down. So that's just my little like one just theory, or kind of ethos that we tried to push to our members, is like, let us help you with the really big stuff, and the
Right.
little stuff you go and figure out, and not figure out, like we'll help you, but like you pay for the little stuff directly, and that keeps that consumerism intact. So it's a hard line to walk.
It is a balancing act.
Yeah.
And yeah, so IBS is like very common in America. I think 10 to
Mm-hmm.
15% of people are, but IBS is in itself not like a root cause. That's just a label on top of
Mm-hmm.
symptoms. It's irritated bowels, basically. So
Mm-hmm.
one of the actual root causes of that is SIBO, small intestinal bacterial overgrowth. It's estimated like 75 to 85% of IBS is caused by SIBO, and that's what I experienced. I was vulnerable to SIBO for a variety of reasons, like stress, traveling, high altitude, new bacteria, like a prior experience in SIBO, low stomach acid, all these things. So I got a bad case of SIBO. It's a reoccurring thing. So I'm getting that sorted out with my provider. But it just makes me think, if we have tens of millions of people in America experiencing IBS, the majority of it's caused by SIBO. And so if Crowd Health has 6,000 members, if you just apply the same statistics, you're going to have hundreds of members who are at some point going to need like a SIBO specialist or a gut health
Yes.
specialist. Is that something that Crowd Health, like, do you have like names for like virtual providers? Because for me in my local area, there's just really not someone that can help me
Yeah.
immediately.
That's really good. Yeah. I mean, and that's where I was like, man, I wish we could get all the crowd health people together so people like you could share this information, right?
Right.
Like it's community generated. Like you say, hey, this is what happened to me. And you should think about this before going and getting all these drugs, right? That the local provider is going to want to give you. Um,
Exactly.
and so that's what I'm really trying to get, is this community kind of feel, that to help each other out on this kind of stuff. So community is important, and we can't answer all the questions. We don't have all of the examples that you have. We had another member who had rheumatoid arthritis, another member who had Crohn's, like all these kind of like autoimmune conditions where they've been able to keep them at bay, by nutritional stuff and some supplements, as opposed to getting $10,000 shots, that just address the symptom. Like, how do we build a community who's fired up about that?
Yeah,
That's
I think
really
that's
what
a great
I'm
idea.
looking for.
Like if like this is so it's so crazy. Honestly, it makes me a little emotional because I was like really, really sick and I'm like trying to get help. And I go to the urgent care, they can't help me. I go to the ER, can't help me. I do an online appointment with a MD and he can't help me. He said, I'll give you a muscle relaxer. Like, I understand like that could alleviate some symptoms, but that's not
Yeah,
getting at the root cause. It's not figuring this out. It's just masking symptoms, which can
totally.
actually make things worse. So then,
100%.
and then actually he said, have you pooped like recently? I said, it's been a few days, but I haven't been eating because, so it kind of makes sense. But he's like, oh, well, if you haven't pooped in 2 or 3 days, then you need to go to the ER because you might have a blockage. I'm like, well, I'm not going back to the ER. And
Yeah.
then he just said, take care and hung up the phone. I couldn't believe it. You didn't help me. And
Yeah.
then, and then I went downstairs, I went and took a poop, and then he was like, well, that was useless. And then, I emailed my PA. I texted my cousin who's a nurse practitioner, and like I got no. I spent 5 minutes with referrals and could not get assistance. And finally, I called my uncle and he said, try Beano. It's like an enzyme you can buy at the pharmacy. I went to the pharmacy, talked to the pharmacist. He said, yeah, you can also try charcoal caps and these probiotics. And so then I finally like got some assistance. So, like the charcoal really helped me. Same with the enzymes.
Yeah, that's
And then yeah,
awesome.
changing my nutrition plan. Just doing like a liquid diet for a few days helped me out, like giving my digestive system a break. So there are things you can do that can help you immediately,
Yeah, I
but
love that.
figuring out what things are is like not easy. So if there was some kind of group where people who have similar conditions can like give each other tips, I think that would be awesome. I'd love to participate in that.
Yeah, it's almost like, maybe you and I can think offline about how to scale something like this, because it's like, how do you kind of collate all these stories? You had IBS, another person's got another condition or illness or whatever. Like, if I have something, where do I go? What question do I ask to find the person who's had something like this, so
Right.
that I can get help? Right? Like, a random
Yeah.
chat room probably isn't it, right? Like, because there's, I don't know, in our Telegram group, I think there's 1,000 messages right now. Like, which one? How are you going to find the one that has to do with, you know, this?
True.
But maybe there's a sub room where it's just conditions. Like, I had this condition, and here's how I treated it. And so it's a resource for other people. I mean, I think that could be
Yeah.
super valuable.
Yeah, it's almost like a mind match. I've been in like communities for like writing and stuff like that, and they basically match people up to just generate new ideas, exchange
Mm,
ideas. And I think it just takes one, everyone volunteers like, yes, I would like to help other members, and then they kind of explain like the conditions they've worked through and how they solved them, and then there's like a third party who can like match people, something like that.
yeah, I love that.
Um, that would
I
be
love that.
brilliant.
Yeah, good stuff.
Um, Yeah, just to follow up on what we were talking about, what I've found is that people who have been through what I'm now experiencing and they've solved it, those are the people that can really help me. So, yeah, for example, the gut health specialist I'm talking to now, Emma
Hmm.
Ford, she herself experienced SIBO and years of not being able to find adequate assistance with that. So she became the practitioner that she wanted.
That's great.
And so yeah, just I think there's a real opportunity for crowd health to connect people with not only local doctors but also virtual specialists.
Hmm.
So I
Hmm.
hope you let me build off this.
Yeah, love it. I love
And I
that
want
idea.
and I reached out to Emma and talked to her about this, like because it is hard to get an appointment with her. Like there's the wait times to see practitioners can be like if you're having like an acute situation, like you want help like soon, right? You don't want to wait 2 or 3 weeks. So I was like talking to her about it, and she was saying like there might be a role for like AI to play in terms of like getting people immediate
Mm.
assistance, and then the practitioner can kind of like follow up later. Any thoughts on AI? Is Crowd Health thinking about AI in any way?
Yeah, for sure. I mean, we're incorporating it into a bunch of different things that we're doing. I think that what we have found is that about 80% of the questions that people ask on a day-to-day basis can be answered pretty easily with AI, using our membership guide and some of our previous conversations with our members as the training data. And so, if you want to talk directly to a human being, that's option A. If you want, option B, which is an answer right now based upon, an AI evaluation of our training data, then you can have that too. So you could have kind of the option of talking to a human, or which might be, a couple hours, or, talking to an AI, bot or whatever, that we're going to call it the virtual care advocate, who has all the background training information, from answering tens of thousands of questions over the last 3 years. Based upon those questions and those answers, it would generate an answer for you. And it's up to you. I think we're going to stay away from kind of clinical stuff to start, just for regulatory reasons. But I think the majority of the other questions can get asked or can get answered.
That's good to hear. Yeah, I'm excited for the future. I think we're in a situation where there's so much improvement that can be made for America's health that I'm optimistic. That's one of the great things about living in this civilization. If you're a high agency person, you really can make a difference in improving this world. So you're a great example of that. So yeah, thank you so much for taking that hour to be here with us and share some of these things.
One more on that AI thing. One of the things that might be interesting, like we just talked about, is if the training data can be stories that other members have had, like your IBS story, right? It's like, hey, what do I do if I have IBS? And it's like, well, based upon our members' experience, which is our training data, here's what they have done. So it's not, if we can preface it by saying, hey, this is not a doctor recommendation. This is a member recommendation. And so we can get, more member data that we can put into that. And I think that's pretty interesting. I mean, could be an interesting way of scaling stories that are similar to what you had.
Yeah, that's definitely something to think more about, because at the end of the day, I think a lot of people aren't already using AI. I know I am, to ask questions, but it's very limited, and I think what they can say, and it doesn't have that human feel to it where someone's so it's really limited right now, but I think it's just going to get better. And I think there is a liability or regulatory concern around, but if you can shift that to someone sharing their own personal anecdote, then that could potentially work. So definitely more to think
as long
about.
As you preface it with, this is what our member experienced, it might be helpful. I think that could be pretty interesting.
And it could also help link people. One of the things I'm excited about is AI for matchmaking. So for example, Spotify most likely uses AI to come up with suggested playlists. TikTok and YouTube have their AI algorithm for suggested videos. What about suggested foods or suggested people to talk to? So an AI could potentially help match you with somebody that can help you.
Yeah, suggested doctors, suggested nutritionists, suggested practitioners of any kind. I think that's right on.
It's awesome. Yeah, I'm very excited to see how this plays out, to see the future of crowd health. I think this is gonna totally be huge. I really do think in the long term that this is gonna be central to the new paradigm for great healthcare in America. So
man, I love it. Thank you for your support. Thanks for being a member, and man, thanks for the story. I look forward to keeping in touch to swap ideas some more.
Yes, and your podcast, the Sovereign Health Podcast, I totally recommend checking that out. How can people get in touch with you, get in touch with Crowd Health?
Yeah, joincrowdhealth.com is our main website. Join Crowd Health on all the major social media platforms is where you can find us. We keep it pretty cheeky and fun on our website and our social media accounts. And so come follow us to see what the latest and greatest is with us.
All right, Andy Schoonover, great chatting. I think we'll stay in touch.
Thanks, man.
Thanks, everybody.
See ya.
Have a good night. Bye.